Hello, good morning. I am Dr. Vikash Kapoor. I am an orthopedic surgeon. And if you look at it from the point of view of an orthopedic surgeon being involved in some kind of activity during this time of coronavirus crisis, it is it looks quite improbable. But actually, there are lots of things which you need to understand about the physical health and how it kind of affects uh, your immunity and your ability to fight these viruses. Now, there are lots of myths and there are lots of things which we have been discussing over a period of time on social media. And on this platform, I would also like to say that this is the time when you need to get back to the basics. This is the time probably when we are having a reality check, when we need to understand that how to treat our own body with respect. We need to understand that if we eat right, if we exercise right, if we do our daily dose of exercises in a proper way, probably we would be physiologically less than 50 years at the age of 60 also. So, as you have seen in the newspaper reports, that a lot of patients who are having susceptibility to coronavirus are diabetics, are hypertensive, are cardiac patients, are kidney disease patients. At the same time, there are people above the age of 55 and 60 which are becoming more susceptible to death in cases like these. So, my suggestion would be for people who are young, and luckily our 65% population of the country is young. It is important that not only do we get ourselves to move, but we need to now make sure that if we have ourselves quarantined ourselves properly last 14, 15 days or 1 month, then we can go closer to our parents and make them also walk, do the exercises, initiate a program at home with our elderly who are living with us to make sure that they do enough exercises to move their joints and to make sure they exercise as much as possible by moving around in the house a little bit, walking at least 4,000 steps morning, evening inclusive. So if in the morning they are able to walk 1,000 steps slowly, they can take a break of 3 hours. Again, they should be encouraged to walk slowly about 1,000 steps. By doing this, we will be able to ventilate their lungs, give them proper training, mobilize their joints, and of course, the blood flow in their body would help them revitalize the immunity. Eating the right food is important. We need to understand the rich food is not the right food at this point of time. It never was. We must understand what we need to eat is again going back to properly washed and cooked meal. We need to properly wash our vegetables which come to us with gloves in our hands. And we also need to make sure whatever we cook at home is properly boiled. We need to avoid eating packaged food for next 6 months at least, till the time we really know and we have complete idea what to do and how to do about things, the way things are going. So my advice is look after your parents, make them exercise with you, get them motivated so that you are around and it is a great time to bond with them, to exercise with them, to give them that facility. Your being with them is going to raise the immunity of their own soul. So this is a great time to be a family. This is a great time to build up your immunity. And of course, please try to boil your vegetables, eat simple and boiled food. It would be a great help to the society and the doctors like us. Orthopedic surgeons, they are working full time. There are lots of people coming to us with fractures and injuries. And of course, we are there to support you. God forbid anybody has a fall at home. But be careful, don't venture out. And if you do venture out at all for any reason, wear the mask, sanitize your hand, cover your hairs, try to expose as less skin as possible, and immediately wash the clothes when you come back home. Put them in soap water, have a bath, so that these old principles of humanity, that coming back home and having a bath before you eat, wash your hands before you eat, are now being shown to us again by a virus to which we don't have an answer. So let's fight this together. Let's be in this together and be safe, stay safe forever. And we are always there for you, fighting for you at a different front altogether with my colleagues. Thank you very much.